Hello, my name is Bastien Rioux. I am a clinical research fellow at the University of Edinburgh, Scotland, UK. This work was a collaboration with researchers at the University of British Columbia, Vancouver, Canada, and I want to thank everyone who contributed to this study. MS is a disease where the body's immune system attacks the brain and spinal cord. Medicines called disease-modifying therapies, or DMTs, help reduce inflammation and prevent relapses. Interferon-β was the first treatment of this kind, introduced over 30 years ago. It's safe overall, but we don't know much about what happens if people take it for a long time, especially when it comes to cardiovascular health and autoimmune problems. This is important because similar drugs, called type 1 interferons, have been linked to cardiovascular and autoimmune problems in other settings. We used health records from people living in British Columbia, Canada, to identify people with MS in that province between 1996 and 2017. We looked at pharmacy records to see who was taking interferon-β and for how long, then followed them for over 20 years to see who developed cardiovascular disease, a composite of ischemic stroke, heart attack and peripheral vascular disease, or autoimmune disease. We followed over 19,000 people with MS. About 1 in 6 had ever used interferon-β for an average of 5 years. We found that the longer someone used interferon-β, the slightly higher their risk of cardiovascular disease became, about 18% higher for every 5 years of treatment. We did not see an increased risk of autoimmune disease. This study suggests there may be a small increase in cardiovascular disease risk with long-term interferon-β use in multiple sclerosis. People taking or who have taken these medicines may benefit from extra attention to cardiovascular disease prevention, things like blood pressure checks or lifestyle advice. The benefits of interferon-β in multiple sclerosis are still clear, but doctors and patients may want to consider this possible risk when deciding on treatment, especially if someone already has heart or blood vessel problems.